Welcome to this presentation. The video has two aims. First, it attempts to give an overview of the many geographical and administrative boundaries that are used in population health management, as data is published at different levels according to the subject at hand. Second, the video shows some of the mapping techniques that are available, including some animations. All of the data sources used are publicly available. This initial map shows the location of the 8 CCGs that cover the Hampshire and Isle of Wight area, and most of this video will concentrate on this area. The geographical size, population size and density vary widely across the CCGs. Across the whole area, the GP registered population is 2.1 million. Population sizes range from the Isle of Wight, with a population of 145,000, to West Hampshire, with a much larger population of 570,000. The other CCGs have populations of between 200,000 and 300,000. This map shows the CCG population projections for the next 25 years for two age groups, with the black circles showing the 0 to 18-year-olds and the red circles showing over 75s. On the Isle of Wight, by 2029, there will be more people aged over 75 than in the younger age group. The gap will also close appreciably for the other CCGs, with the younger age profile of the cities much more apparent. This map shows the percentage of each CCG's over 75 population for the next 25 years, and the importance of this is that activity rates in secondary care increase sharply from the age of 75. For West Hampshire CCG, for example, the over 75 age group made up 11% of the population in 2018, and this is expected to rise to 18% by 2043. We are now looking at the increase in the number of people aged over 90 each year by CCG, another indicator of demand for health and social care. The effect of the high birth rate following World War II can be seen in the mid-2030s, with a particularly large increase in 2037. After that year, the rate of increase slows. Output areas are the smallest data building block in the census data. They contain at least 40 households and 100 people, with the target size being 125 households in each output area. There are about 170,000 in England, of which 6,100 are in Hampshire and the Isle of Wight. In urban areas, these can be very small geographically. There are about 33,000 lower layer super output areas in England. 1,200 of these are in the area covered by the maps in this video. They typically contain 4 to 6 output areas with a population of around 1,500, but these vary widely, for example where building has occurred on a large scale since the last census. There are 6,800 middle layer super output areas in England, of which 243 are in Hampshire and the Isle of Wight. There are approximately 5 lower layer super output areas in each middle layer. On average, they have a population of 7,200. The administrative wards shown here are approximations based on the lower layer super output areas. These approximations can be useful as much data is published at a lower layer super output area level, and it can be matched to wards as appropriate. There are approximately 50 primary care networks in Hampshire and the Isle of Wight. The boundaries on this map are notional and are based on the lower layer super output areas in which the registered patients live. In reality, there is much overlap of the populations covered by primary care networks. However, such a map is useful for showing the relative position and size of each network. There are approximately 150 county councils and unitary authorities in England. In Hampshire, there are 4 of these: Hampshire County Council and the 3 unitary authorities, Southampton City Council, Portsmouth City Council and the Isle of Wight Council. There are just over 300 districts in England. These have a number of classifications: unitary authorities, metropolitan boroughs, London boroughs, and non-metropolitan districts. Unitary authorities are single-tier districts which are responsible for running all local services in their areas, combining both county and district functions. There are 14 districts in Hampshire and the Isle of Wight. The Hampshire County Council area is divided into 11 districts, plus the 3 unitary authorities of Southampton, Portsmouth and the Isle of Wight. There are approximately 180 GP practices in the Hampshire and Isle of Wight area. The colours of the dots on this map indicate which CCG they belong to. In this example, the map is zooming in on the Southampton City CCG area. The acute hospitals in and around the Hampshire and Isle of Wight area are shown here. In a number of cases there are 2 hospitals near one another, one NHS and one private. The care home location information is published each month by the Care Quality Commission. A number of clusters of homes can be seen, for example to the south of the New Forest at New Milton. In this example, the population is shown by district for each year from 2001 to 2019 and highlights the variation in size of the population by district. The national increase in the population was 13.8% during this period. This map focuses on the Hampshire and Isle of Wight area. The increase in population was 11.8% during this period. This represents an additional 210,000 people living in the area since 2001. Every lower layer super output area has a national deprivation score. This map shows the areas with the highest levels of deprivation in Hampshire and the Isle of Wight, with the most deprived areas in the darker shade of blue. Understanding levels of deprivation is important as it is a major factor in health inequalities. This map shows all the lower layer super output areas in Hampshire and the Isle of Wight. Here we are looking at one type of pollution, particulate matter, which is a wider determinant of health. Higher rates of particulate matter can be seen along the major roads in Hampshire, such as the M3 and M27. Here we see an example of bringing together two types of information so that they can be explored in a different way. In this example, the lighter purple areas on the map are the more deprived lower layer super output areas. This has been combined with the blue bar, which shows the percentage of people in that area who described their health as very bad in the 2011 census. Combining data in this way can be a useful tool and can bring things to life where complex relationships are difficult to interpret.